Hello, Diaz here, founder owner of Greenwood Dental. Today we're talking about toothpaste. Yes, it's the one thing that my patient and my hygienist are constantly debating what to use, what not to use, what's good, what's not in the market. Now, I'm not a scientist and I don't have a lab that I'm taking toothpaste and testing it. All I'm gonna do is basically let you know what I think of what I have read about different toothpaste and the trends in toothpaste and what I have seen over the years, my observational data. Charcoal toothpaste. Okay, charcoal toothpaste became a trend because a lot of the celebrities promoted the charcoal toothpaste as the cool thing to do, and it's charcoal and it's black, and they made like videos on Instagram and pics on Instagram like how cool it is and makes your teeth white. So what they did with charcoal toothpaste is basically they took the carbon particles and they treated the carbon particles to be very, very porous, hoping that when you guys brush with the charcoal toothpaste, it will attract and trap all the stain. According to them, when the charcoal toothpaste came out, it actually traps viruses and bacteria. Now, in 2019, there is the British Dental Journal debunked the whole finding about the fact that charcoal toothpaste will get rid of viruses and bacteria. So as far as the charcoal toothpaste, if you want to use it in conjunct to the toothpaste that you regularly have, that's fine. But I will not use it as just the toothpaste that you use. I would use it maybe twice a week to get rid of some of the stains, but keep using whatever your dentist recommended and whatever you're used to. The other thing is that taking a huge hype of the market is the Colgate and the Crest whitening and the Vitality Crest, all these whitening and bleaching toothpaste. The only thing about these products, if you are happy with them and you don't have any side effect, then that's fine. But the only problem with some patient, they're having challenges with these products is the SLS. The SLS, which is sodium lauryl sulfate. Sodium lauryl sulfate is basically a synthetic detergent that's added into toothpaste to make the toothpaste very, very foamy. And the more foam you feel, it's psychological. That it's cleaning better, or it's cleaning more. But as you know from my brushing video, it's all about your brushing technique and your brushing tools. So it's not about the toothpaste. I believe toothpaste was made to encourage us to brush the full 2 minutes, so we're not like slacking on the duration of brushing. So what happens is the SLS, unfortunately, we're finding out that it blocks the fluoride effect on your teeth, which is very critical, because if somebody needs the fluoride to keep the mineralization of enamel or slow down the decay process of demineralization of the enamel, or protect the enamel that's been under a lot of acidity, like pregnant moms that throw up all the time, or bulimic patients, or the patient that have a lot of acid reflux. So that's very important to know that SLS will block the fluoride effect on your teeth. Now, the other thing that we are seeing clinically with the SLS effect is what we call a contact dermatitis, which is irritations of the gums in a degree or in a way that the gums are actually peeling. So there's peeling of the gums, peeling of the inside of the cheeks, and that gets really, really sensitive, and sometimes it burns. And we're finding also a patient that continue to use toothpaste with high SLS concentration will end up with a lot of canker sore or mouth sores. So if that's the case, please stop using these products and go back to just Sensodyne or just basic fluoride like toothpaste, like I said in my other video, like Ames or Tom's of Maine or Arm & Hammer. Now, the highly recommended toothpaste for every single day for a patient that has dry mouth, whether patient are medications for dry mouth that causes dry mouth, or they are doing radiation or chemo, or they're compromised medically, which will cause as side effects as dry mouth, is basically a baking soda based toothpaste. Baking soda is basically sodium bicarbonate. Sodium bicarbonate, we're finding out that that product helps neutralizes the mouth or bring the pH higher in a very favorable way in order to not encourage the bacteria to, you know, create the biofilm that causes decay. Because I've seen it with especially patients that are taking anxiety medication or depression medication. The side effect is very, very dry mouth. So I always recommend a baking soda based toothpaste. So that's that. The last one, which is the star of all toothpaste, is the Prevident 5000. Prevident 5000 is an excellent prescription toothpaste for a lot of patients that has been challenged with a lot of medical conditions or underlying conditions that causes dry mouth. There is the Ortho Defense one. There's the dry mouth sensitive gums, and also the booster. And we give it out to patient all the time, or prescribe it with a patient all the time that has those side effects, medical side effects especially, or they cannot keep things under control or balance in their mouth. Prevident is by prescription. Either you can get a prescription from us and dispense it from the pharmacy, or you can buy the Prevident from our office. So this is just a quick summary of the toothpaste out there, but if you guys would like me to make another video, I'll be very happy to go through a little bit more details, do and don't. I'm sure I'm gonna make another video about toothpaste. So let me know, and I hope this helped. We love you guys. Be safe, and DS out.